We all know someone who's had a heart attack. What if we could prevent that from occurring? Stay tuned and I'll tell you how. I believe we can prevent heart attack. We can put in place strategies to reduce risk. We can literally plan to change your future. I call it Healthy Heart Network. Hi, my name is Dr. Warwick Bishop and welcome to the Healthy Heart Network. I'd like to share a story with you that changed my life, but it nearly cost a life. On a Sunday morning in 2005, I was on my way to work and a fun run was in progress on one of the main streets as I was approaching my hospital. I saw there was a commotion by the side of the road. There was an ambulance in attendance, a group of people huddled around. I thought I might be able to help, so I stopped. It turned out a 52-year-old man had collapsed during the race. He'd had a heart attack. I was involved in his resuscitation and thankfully things went so well that he ended up on the front page of the newspaper a couple of days later. I took the newspaper to my office to show my staff because I was genuinely proud that I'd been involved in such a good outcome. My secretary was quick to point out that I'd seen the very same man in 2003, about 18 months earlier. I'd done a treadmill test on him, which was negative. I had reassured him that everything was fine. This realisation was confronting. I had seen the man, I had told him he was okay, and then found myself involved in resuscitating him by the side of the road. What had I done wrong? What could I have done differently? And what can be done differently? We're all aware of the stats. Cardiovascular disease accounts for 50% of all deaths in the Western world. It kills 350,000 Americans per annum, and every 40 seconds in the United States, someone dies from coronary artery disease. But it's not the stats that move us, it's the human cost. We all know someone. Stories of young lives lost. Husbands, wives, sisters. Could it be you? Could it be someone you love? And can we do better? Can we find people who are at high risk of a heart attack before they have a heart attack? Let me tell you about Peter. Peter was a big man. He was a builder. He was 35 years of age and he had a high cholesterol. There was no significant history of coronary artery disease and every doctor he'd seen had wanted to put him on cholesterol tablets, but he just wasn't up for it. I said to him, perhaps we could image his heart and look at the health of his arteries. And so we did. And this is what we saw. For his age, this showed a lot of plaque. There's no question. We could see the process that was going on in Peter and we could have a real discussion about what treatment and intervention might look like. This time the discussions about medications had a real endpoint. He was actually really happy with that information, that discussion. He was informed, he was engaged. He now takes 2 tablets to lower his cholesterol. He's embraced enormous lifestyle change and without doubt, we've made a difference for him, his wife and his 3 children. Well, so how do we assess risk? What are traditional risk factors? They're things like age, being male, but females get coronary artery disease as well, cholesterol levels, blood pressure, diabetic status, smoking, we all know this, even family history. Well, does having these risk factors mean you'll have a heart attack? And does not having these risk factors mean you won't? Well, think about it. People you know who in spite of all these risks, they just keep going and nothing happens to them. And I bet you know people who, like the fun runner I just described, drop dead and you don't understand why. It even happens to famous people. They're not immune. Think of the urgent surgery that President Clinton needed in September of 2004. He was only 58. Think of the sudden cardiac death in 2013 of James Gandolfini, better known as Tony Sopranos of the Soprano TV series. He was only 51 and on holidays with his family in Rome. Last year in Australia, a world-ranked triathlete at 47 years of age died on his way home after training. So why do people seem 1 minute to be perfectly well and the next minute having a heart attack? Well, who am I to be talking to all this? I graduated in medicine in 1988. I completed my specialist training in 1997. That means I've been looking after hearts for over 20 years. I was the first in my state to undertake training for imaging the heart. That was in 2009 using CT technology. I'm a member of the Australian Atherosclerosis Society, the Familial Hypercholesterolemia Australasian Network. I'm involved in writing lipid guidelines. I'm an examiner for the College of the Royal Australian College of Physicians. I'm an affiliate with the Menzies Institute for Medical Research, and I sit on the board for the Heart Foundation called the Clinical Issues Committee. All this is a heck of a mouthful, but it basically means I should know my stuff. So why did I produce this series? Basically because I care. I want to see heart attack a thing of the past, and I believe we can do better. What this series is about is empowering patients to be involved in their best care by being educated and informed, because I truly believe the best educated patients get the best care. In the following series, I'll cover important issues like understanding your heart, the structure and function, how we currently assess risk, association versus causation, a scattering of case studies to try and explain concepts by example, how you can be more precise about your risk, understanding the art of medicine, looking at the arteries by scanning the heart and what that means, taking results of imaging to incorporate that into the best holistic decisions for your heart health. I want you to live as well as possible for as long as possible, so I'll be explaining symptoms and prognosis. I'll talk about things like why there's such a fuss about statins and who should be taking them. I'll be covering all that plus more. I have the opportunity for an interview with Matt Budoff, a world expert in imaging the heart and prevention, and I'll also have an opportunity to speak with a dietitian around all sorts of heart-related dietary advice. Stay tuned for our case study, Simon, a 42-year-old man with attitude. Welcome to our first case study. Each week we're going to be sharing a case study to help inform and illustrate different concepts of heart care. This episode I'm going to tell you about Simon, who was 42 years old at the time that I met him. He was a fit fellow with a confident swagger. He wore black jeans and work boots. He was in the building industry. He came to see me because he was concerned about the family history. His father had passed away from a heart attack at 51 years of age, his grandfather at 53 years of age. Simon's lipid profile, or blood tests, didn't show anything particularly unremarkable. His good cholesterol was pretty average, his triglycerides were pretty average, and so was his cholesterol. He was not diabetic, and he had no blood pressure issues. He was a smoker, and he did exercise a lot. In fact, his exercise was competitive judo. So when I suggested that perhaps he just give up the cigarettes, he didn't quite warm to that idea. Nonetheless, we had a chat about what could be done and whether we could perhaps get more information about his risk, and I suggested imaging may be valuable. And in fact, we did proceed on to do that. These are the images of his heart. And you can see these arteries here clearly with irregularities. For this man at his young age, we were able to demonstrate evidence that there was something definitely going on. We put him on the right treatment, we thinned his blood, we lowered his cholesterol. We had another conversation about smoking cessation, and this time he was far more receptive. We've actually become quite good friends, and he comes back on a regular basis just so I can keep an eye on him. All in all, he's doing well. Stay tuned for our last segment, which is patient questions. Hi, welcome back. Each episode, I'm going to answer a common patient question. This episode, the question is, what's a heart attack? Well, let me tell you that heart attack is not a medical term. It's a layman term. It tends to be used when someone has had a sudden and unexpected event involving their heart. More often than not, people will refer to a heart attack if it's killed someone, which is a disaster, of course, or if it leads to that person needing to be brought into hospital for some sort of intervention. A problem with the heart that can occur suddenly might be related to a valve, because there are 4 major valves in the heart. A problem that could affect the heart suddenly may be the electrical system. If the electrical system goes out of sync and is not working properly, this can certainly cause major problems. But the most common reason for a heart attack, the thing that I want to focus on mainly, is the sudden blockage of blood flow to the muscle of the heart. This is the situation where the patient will be unwell. They will describe chest pain, they'll be sweaty, short of breath, they'll know it's not right. It's the classic that we see on TV, more often than not, a clear problem that needs immediate attention. The patient, of course, will go immediately to hospital and get appropriate tests. The dots are put on the chest to generate an electrical trace of the heart. Blood tests are taken so that we can measure biomarkers or indicators in the bloodstream that may be reflective of damage to the heart muscle. The medical term that we use for someone who's had a blocked artery giving rise to damage to the heart muscle is a myocardial infarction. Myo pertaining to muscle, cardial pertaining to the heart, and infarction is a word we use for death by lack of blood supply. So myocardial, muscle of the heart, infarction, death by lack of blood flow simply means blockage of blood flow to a piece of muscle with the subsequent end result being that some of that heart muscle dies. So it's a sudden blockage of an artery that is the problem. This can be the case for people who appear to be well 1 minute and literally dead or critically ill the next. Let me show you a little bit more about that. The build-up of cholesterol in the arteries can be non-flow limiting. In the early stages, plenty of blood can get through a lesion that's not narrowing the artery too much and get to the heart and supply blood appropriately, particularly if that person increases their exercise capacity. But as that plaque builds up, it can become flow limiting, so that when this person works harder and requires more oxygen, more blood to their heart, perhaps not enough blood gets through and they'll start to get the symptom of chest pain. What happens in a heart attack, though, is the sudden blockage of an artery. And how does that occur? Well, in either an artery that's not causing a narrowing or an artery that is causing a narrowing, that is flow limiting, there can be a rupture of the plaque. The cholesterol plaque can literally break down and the contents of the blood come into contact with the contents of the plaque. And that mix of those two structures can lead to sudden formation of clot that we call thrombus, and if that thrombus grows, it can grow to an extent that it can block off a non-flow limiting lesion and more easily, in fact, block off a flow limiting lesion. It's that sudden blockage from a clot forming through the rupture of a plaque on either a non-flow limiting lesion, someone who looks perfectly well before an event, or on a lesion that may be narrowed, someone who may have had some signs beforehand, that gives rise to complete blockage of blood flow to the heart and death of the heart muscle. Myocardial infarction. That concludes this episode. Thank you for joining me. I hope you feel educated and informed, and I'm sure you're looking forward to the next teaching episode. Until next time, please don't die from a heart attack. Want to know more? grab a copy of my #1 best-selling book, Know Your Real Risk of Heart Attack. It's available as a hardcover, a paperback and an audio from Amazon, or wherever good books are sold.